Welcome. We would like to share with you some information about electroretinography use in a veterinary practice. We know that ERG has been perceived as difficult and time-consuming in the past. LKC Technologies developed the RETevet to address these issues. Our video starts with Professor Ron Ofri from Hebrew University of Jerusalem, Koret School of Veterinary Medicine. Professor Ofri has been teaching generations of veterinary ophthalmologists and is the author of more than 100 publications. This includes being co-author of Slatter's Fundamentals of Veterinary Ophthalmology, a book we are sure you all know well. Professor Ofri will talk about the basics of ERG and its importance for veterinary practices. We are also happy to include in this video feedback from two RETevet users. First, Anne-Marie Verbruggen from Belgium. Dr. Verbruggen is the current president of the European College of Veterinary Ophthalmologists and the owner of the Eyes Animal Ophthalmology Clinic in the Netherlands. Second, Federica Maggio from the US. Dr. Maggio is a clinical assistant professor at Tufts Cummings School of Veterinary Medicine. Dr. Maggio is also a practicing ophthalmologist at the Tufts Veterinary Emergency Treatment and Specialties Center in Massachusetts. At the end of the video, Dr. Guo He from Shanghai, China, recorded a test to show how easy it is to perform a RETevet dark and light adapted test on a non-sedated animal. Please feel free to contact your local LKC representative if you'd like to receive more information on the RETevet. If you are located in Europe or Asia, please see the information about our upcoming ERG courses in Germany and China.
Hello, everyone. My name is Ron Ofri, and I am a professor of veterinary ophthalmology at the Hebrew University of Jerusalem in Israel. I've been asked to talk to you about why ERG is crucial in your veterinary ophthalmology practice. By the way, this is what an ERG looks like today in this age of the corona pandemic. And I take the opportunity to wish you and yours and everyone everywhere in the world that we will soon overcome this horrible disease. So this is really just a very brief introduction to an ERG. If you want to learn more about it, I'm happy to invite you to two courses I'll be holding later this year, August 29th, 30th in Frankfurt, Germany, courtesy of Eckemeyer, and December 14th, 15th in Nanjing, China, courtesy of LKC and CSAVS. So I think it is fair to say that most veterinary ophthalmologists record an ERG for one of two reasons. The first one is preoperative evaluation of cataract patients. Here is a patient with an advanced cataract. You want to go into surgery, but obviously there is no point in going into surgery if the retina is degenerate, such as the retina you're seeing on your right-hand side. However, with such an advanced cataract, obviously you're unable to examine the retina. You have no way of knowing whether you should or should not go into surgery. The only way you can determine that is through an ERG recording. In fact, my teacher at the University of Florida, Dennis Brooks, who many of you may know, says that doing cataract surgery without preoperative ERG is really equal to malpractice. Doing an ultrasound is not enough. It will tell you whether the retina is in place or not, but not whether it's functioning or not. Testing PLRs is not enough because you don't require much afferent input for a PLR. You must do an ERG. Here we are doing a preoperative ERG in a lemur from the local zoo. She's a 20-year-old lemur who was just blinded by cataracts. Lemurs have a life expectancy of 30 years. The ERG recording was good. We went into surgery. She's visual, and hopefully she will be able to see for another 10 years or so. The second reason for doing an ERG recording is to determine whether a patient is blind due to cortical disease or retinal disease. In both cases, you may have a normal-looking fundus or amaurosis, and really the only way to differentiate between the two is through an ERG. The classic example is STARS. and distal optic neuritis. Here on the left, you have a patient with an obvious case of optic neuritis, so I think we don't need an ERG in this patient to determine the cause of blindness. However, in the patient here on the right, we have a normal-looking fundus, and the patient is in fact blind due to distal optic neuritis involving distal portions of the optic nerve, which is why the fundus looks normal. This patient will present with acute blindness, fixed dilated pupils, and amaurosis or normal-looking fundus. Just like a SARS patient, they also present with acute blindness, fixed dilated pupils, and normal fundus. The only way to differentiate between the two is through an ERG recording. Now, I imagine that some of you are telling yourselves right now, well, actually, we don't need an ERG to diagnose optic neuritis. We can do that with chromatic PLR. So I'd like to draw your attention to this paper from 2017 by our colleagues from North Carolina State University, looking at 96 cases of optic neuritis in dogs. Patients underwent workup, which included complete blood count, biochemistry, urinalysis, serology, imaging, CSF, fluorescent angiography, and of course ERG. 0 patients underwent chromatic PLR. 0 out of 96. So at least the folks in North Carolina State University, and you can see some highly respected ophthalmologists as co-authors of this paper, did not feel that chromatic PLR testing was indicated in their patients. I was also happy to come across this paper published by Keith Montgomery in 2008, looking at 120 dogs with SARS and 20 dogs with neurological disease or optic neuritis. And the conclusion of Keith Montgomery is that an ERG is necessary to rule out neurological disease in cases of amaurosis. Basically, the ERG is normal in cases of optic neuritis, such as the recording you're seeing here on the left, and it is flat in SARS. I don't think you need to attend the upcoming ERG courses to tell the difference between these two recordings. So these would be the main indications of recording an ERG in veterinary ophthalmology, either for preoperative screening of cataract patients or for workup of patients with amaurosis. However, there are also other indications for recording, and here are several papers I published on the subject. In this paper here, we used an ERG for a workup of Bengal cats with progressive retinal degeneration, so-called PRA or PRCD, and we used the ERG to monitor the progression of the disease in these cats. Day blindness is a disease where patients present with a completely normal fundus, and the only way to really confirm a diagnosis of day blindness is through ERG recording of cone function, which is what we did in this paper reporting on day blindness in sheep. And finally, this paper from 2018, where we used ERG to determine prognosis of patients undergoing retinal reattachment surgery. So if you have a patient with retinal detachment and you are considering referral to a vitreoretinal surgeon, then in fact you can use the ERG to determine the prognosis of surgery and whether or not you should refer. So these are some of the additional subjects we'll be discussing in the courses I mentioned. We'll be talking about the origin of the ERG, where it comes from, so a quick review of retinal anatomy and physiology, how to separate responses of rods and cones, how to record an ERG, how to prepare your patient, what you need in the way of equipment and protocols. Here is a handy tip for you. You can see me wearing a headband with a red light, so that allows me to record an ERG in the dark while keeping both hands free. We'll talk about problem solving and troubleshooting, mainly how to overcome noise and other troubles. We'll discuss other ERG modalities, the benefits and limitations of each one. Obviously, we'll discuss clinical cases, and in both courses, we'll conclude with a wet lab on dogs. So I would like, once again, to take the opportunity to invite you to attend the courses, either in Germany in August or in China in December. Hoping to see you in one of those locations. Thank you very much.
Hello, my name is Anne-Marie Verbruggen. I'm a specialist ophthalmologist, diplomate of the European College of Veterinary Ophthalmologists. I'm the owner of Eyes Eye Clinic in Breda, the Netherlands. My special interests in ophthalmology are hereditary eye diseases screening and diseases and surgery of the anterior segment, cornea and eyelids. I must admit that the electrophysiology of the retina has never been my forte. I've left all the ERG exams to my colleague who's also performing the cataract surgeries. For me, the ERG exam was too many fine-tuning and background noises that you had to cancel and all these sedations, and I didn't have the patience to do that. I was fortunate to have the possibility to test out a new device, the RETevet. I was also very lucky to get some professional advice and backup from LKC. I was positively surprised at how fast the exam could be performed and well tolerated by the patient. So far, I only had to sedate one crazy French bulldog puppy. It is also very nice to have the owner with you in the room while you're doing the exam, so they can see what you are doing, they understand what you are doing, and they are more understanding also of the results because they can see it directly on the screen after the examination. Using the RETevet has triggered my interest in the electrophysiology of the retina again, and I'm very keen to open books again, and maybe also, if the actual situations allow it, to go to the seminar that is going to be given by Ron Ofri in August this year together with Eichenmeier. I thank you.
Hi, my name is Federica Maggio, and I'm the ophthalmology specialist at Tufts Vets, a veterinary specialty hospital located southwest of Boston in Valpole, Massachusetts. During my regular work schedule, I see patients 3 days a week and perform surgeries twice weekly. A prominent part of my surgical appointments is represented by cataract surgeries in dogs, and in that context, surgical screening by electroretinography plays a critical role. I first heard of RETevet from some of my colleagues who were very happy with it and told me of how easy it was to use. And since I found myself in need of replacing my old ERG machine, I contacted LKC Technologies and purchased a RETevet unit. My experience with RETevet has been great. I am actually quite impressed by how straightforward and supple this device is. I mainly use it for pre-surgical screening of cataract cases, but I also use it for the diagnosis of retinal disorders, for example, sudden acquired retinal degeneration syndromes and progressive retinal atrophies. There are several features that make this device appealing. We can start with the fact that you don't need a laptop or a computer in general to operate it. It's a simple handheld device, quite light, and that you can easily hold in front of the animal's eye during the test. I also love that it comes with a mini Gansfeld bowl with a very, very soft eye cup that shields the eye comfortably, especially for the patient. An additional ingenious feature is that the device includes a real-time camera that allows you to monitor the patient's pupils during the testing. In this fashion, the device is perfectly placed in terms of distance over the patient's eye at all times. I must confess that I am a technology junkie, so for me, one of the top perks of this machine is not only the ease of data recording, but especially the ease of data downloading into my digital medical records software. It is a quite seamless process, easy, very quick, so that the PDFs of the ERG's tests I have recorded are permanently included in my patient's medical record. LKC Technologies has been extremely receptive to my professional needs. They are very quick to respond in terms of software updates and improvements, especially regarding the ERG protocols. They will work with you if you have special requests in regard to protocols tweaking, or if you wish for a different protocol entirely. In short, my experience with RETevet is extremely positive, and I would recommend it to every colleague working in a clinical setting like me.
I'm Hui from Shanghai Phyllis Pet Ophthalmology Clinic. Today, I will present a light adaptation test. I have done the dilation for this dog 20 minutes before. We can do the topical anesthesia 5 minutes before the test. Now we turn on the device. Select the protocol. Retina Function Testing. Then select New Test and enter the animal's ID. Place electrode on him. Red one is the active corneal electrode. This green one is ground electrode. Black one is reference electrode. I suggest to align RETevet as close to the eye as possible. We can remove the ring. Let's start test, and we need to see the ERG jet is always at the center of the pupil, and we can see this through the circle from the screen. Follow the command on screen to continue the test. Now, move to test the left eye and repeat the same steps. After we finish the test, the most important thing is you must wait the date to be saved to finish the protocol. Then we can either see the result from the screen or from your computer. The report shows the dog has good retinal function